All right, let's kick it off. Let's kick it off. For those of you who maybe your first time watching this is my name is Dr. Mike Okouchi. I'm a holistic chiropractor out here in Irvine, California. We do this daily scope on health so that we can give you guys information, because there's so much information out there that it's information overload, and we often get confused. And what happens when we get confused? We just don't do anything. We get paralyzed. And especially when it involves our health, we need to take proactive action on it. And all this week we're talking about digestion and the importance of digestion. And tonight we're going to talk about why indigestion, if you don't get this resolved, is going to end up costing you thousands and thousands of dollars. And not many people really look at that link between digestion and all these other ailments that your body goes through. But by the end of tonight, you're going to have a little bit of a realization how important digestion is. So yesterday we went over the whole digestive process, from your brain down to the time you poop it out your back end and getting the food out. And we talked about one major thing, right? We talked about one major thing and how important it is to have proper digestion, because even if you have a clean diet, if you're not absorbing what you're eating, it won't matter. And when we're not absorbing what we're eating, we're not getting in the nutrients, right? If we're not getting in the nutrients, then we got all kinds of issues, and that's when we start dealing with all of these nutrient deficiency diseases. So, if you guys got out your pens and papers, let's start writing. Let's start taking some notes, okay? So we're talking about the whole idea of indigestion. So now we ate our food. And what does our body have to do? It has to break down the food into its smallest usable components. Whether it's proteins or fats or carbohydrates, it has to break it down to lipids, it has to break it down to amino acids, it has to break it down into glucose, so that your body can then utilize it for whatever it needs. Now, when the majority of the foods, if it's not being broken down in your stomach, particularly protein. We're going to be talking a lot of protein, because believe it or not, here's a bombshell that a lot of people don't really realize, is that we are primarily protein deficient. Regardless of if you have a high protein diet or not, we are protein deficient. Now, a lot of people may look at that and say, that's impossible. I eat a lot of protein. Well, remember I said, it's not what you eat, it's what you break down and absorb. So here's what happens. As you get older, you make less and less hydrochloric acid. So by your mid-20s, you are actually making about 40 to 50% less hydrochloric acid in your stomach than you were in your teens. This also goes for digestive enzymes as well, but mainly hydrochloric acid, because hydrochloric acid will break down the proteins into the amino acids. It will cleave all those bonds so that your body can start utilizing it. Now, what happens as you age and you don't make enough hydrochloric acid? Well, the protein foods that you're eating doesn't get broken down, so it sits there in your stomach and starts to putrefy. This is a nice way of saying that the protein starts to rot in your stomach. Okay? And when the protein starts to rot, you're left with all kinds of toxins that food creates. And it also creates an imbalance in your colon with the bacteria that live in there, what's called your microbiome. Okay, so we're auto-intoxicating. It rots in your stomach. Yeah, not your colon. It sits there in your stomach and rots. One of the main reasons why people feel heartburn. Okay, and there's a couple other reasons which we're going to go over tomorrow. We're going to go over food combining. We're going to go over what you're going to do to help this, all the natural things that you can do to help remedy all these ailments that's going on in your digestive system. Because remember, your digestive tract is the most prone out of all the organs in your body to cancer. So we want to minimize your risks. And there's a whole host of reasons why your gastrointestinal system is one of the biggest targets for cancer. Okay. And it starts with how your body is digesting these foods, primarily protein. So a lot of people don't realize that you're actually having protein shortages in your body. So here's the signs and symptoms of protein shortages. Okay, arthritis. Arthritis is a big one. Joint stiffness upon rising in the morning that gets better as the day goes on. That's a real big one. These people are commonly being succumbed with osteoarthritis, stomach ulcers, colitis, bursitis, sinusitis, sinus infections, dermatitis. Okay? And there's a whole reason why this is happening, by the way. And it's all linked towards protein shortages in your body. Anemia. Then last week you talked about, or the week before, I'm sorry, about hormonal issues. If you're not breaking down protein properly, you're not making the proper hormones for thyroid. Rosacea is a totally, that's a different aspect. Well, I shouldn't say it's a different aspect, but there's a digestive component to it, but there's another component to it as well that has to do with like vitamin C and all that stuff. So thyroid issues, not breaking down the proteins enough to make the hormone thyroxine, enzyme shortages in your body. Remember, we have two different pools of enzymes. We have your digestive pool, and you also have your metabolic enzymes that helps to catalyze the different types of reactions in your body. And then just the overall growth and repair of the tissues. So as you're aging, your body is breaking down a little bit more rapidly. And then we need the protein to build that back up, to build that cellular integrity. So people who have premature aging, where they have a lot of wrinkles, it's because their body can't utilize the protein that they're eating to repair their skin so that the wrinkles don't appear. And then what do we turn to for that? We turn towards Botox and all of these things that has nothing to do with the cause of why these things are happening. Exactly. Digestion is a major key to overall health. If you cannot digest properly, it doesn't matter, right? You could be eating the best diet in the world, but if you're not absorbing those nutrients, it doesn't matter. So now, the reason why I said that not fixing your indigestion is going to cost you thousands. Look, almost every single disease out there is because of a deficiency in some type of enzyme, mineral, proteins, fats, or carbohydrates, your macronutrients or your micronutrients. And that deficiency will cause an imbalance where something else will rise. So let me give you a brief example of the effects of protein shortages in your body. So if you don't have enough protein to utilize in your body can't make a whole bunch of things. Hormones, it can't make immunoglobulins, which is for your immune system. So you start to have a lowered state of immunity. And a big one, and this is how I view it in practice, this is what I see a lot, is when people come in with joint disease or degenerative joint issues, where their spine is breaking down, their shoulder is breaking down, their knee cartilage is wearing away. And that all happens because of a protein shortage from indigestion. So here's what happens is if your body is not digesting and assimilating proteins, your body has to go somewhere else. Where does it go to? It primarily goes to your joint surfaces. The synovial tissues has about 30 to 40 times more protein than any place in your body, including your muscles. So your body starts to break down your joints for that protein shortage so that you can utilize it for other things. That is way more useful to keeping you alive. Remember, your body prioritizes survival over thriving. Okay? So keeping your heart pumping is way more beneficial to you than getting a cold or keeping you immune from a cold. Okay? So if you have a lack of immunity and the immune state is always on the lower side, it's always linked towards a protein indigestion. So here's how you can tell if you have a relative protein shortage in your body. So if you get a lab test, pull out your lab test and they should have ran a complete panel that will show a couple values, okay? Oops, hit that over there. You want to look at your total protein, okay? So look at your total protein and then look at another value called albumin. And what you're going to do is you're going to take total protein and you're going to subtract that from albumin. I'm sorry, reverse that around. You're going to subtract albumin from total protein. Sorry. So total protein minus albumin, that's going to give you what's called your serum globulin. Very big words. I'm sorry if I'm getting all technical here, but you want to know this number. This is very important. So total protein minus albumin equals to your serum globulin value. Now, the serum globulin value, exactly, serum globulin, should be between the values of 1.9 to 2.9, maybe 1.5. That's a stretch. I like to see somewhere between 1.9 to 2.9. Okay, 1.9 to 2.9 grams per deciliter. A lot of other labs, they list this at a higher range, but whenever, if you're greater or equal to 3 grams per deciliter of your serum globulin, you are in a relative protein deficiency. So when you start hitting 3, your body will start robbing other tissues of protein. 1.9 to 2.9 serum globulin, exactly, grams per deciliter, exactly. Thank you for writing that out. So when your body starts robbing other tissues, it'll rob your joint surfaces. Can we expect PCs to analyze like this? Analyze, I don't know what you're meaning by the word analyze there. But most people, so if your question is, do most people will be affected by this? I see about 9 out of 10 people will be affected by this because most people don't make enough hydrochloric acid as they age. So we're prescribing all these antacid drugs or these proton pump inhibitors where it has nothing to do with making too much acid. It has everything to do with making not enough acid. And there's a couple nutritional components. Primary care physicians running blood work. Absolutely. Yeah, your PCP should be able to run the blood work and you should be able to figure that out. Okay, so again, let me repeat that. It's very important. So your serum globulin is your total protein minus albumin. That number again should be about 1.9 to 2.9. If it's above 2.9, if that's 3 or greater, you are in a relative protein deficiency. Okay, tomorrow I'm going to talk about what do you do about that. Well, tonight we're talking about how this is affecting our bodies. Okay, because a lot of people don't link the things that is going on in their bodies to their faulty digestion. And that's a really big one. That's when a lot of patients, when they come into my office and I talk to them about we're going to fix your digestion because maybe you have heart disease, or even you know, whenever I see patients who are going through stage 4 cancer, they look at me funny and they say, why are we working on my digestion when I have lung cancer or when I have blah blah blah? It says everything begins and ends in the gut. We got to get your gut functioning better. Because if you're not digesting and assimilating properly, you can't get the nutrients in and you can't keep the toxins out. Okay, so hopefully this was helpful, and tomorrow we're going to go over what we're going to do about all of this malfunctioning and indigestion in your body. Again, connect with me on at What Up Doc University, and head on over to the thoughts about SIBO. Yep, we're going to talk about all of that later on this week. So hopefully you guys got some great information. Share this with your friends and family, because a lot of your friends and family are suffering from diseases that they don't necessarily know that's linked towards getting their digestive system back in order. So we'll see you guys next time, tomorrow, 8 o'clock. And if you guys have any questions, don't be afraid. Feel free to reach out to me. But till then, take care, be well, and aloha.